Okay, now it's time for one of our most popular segments, the Invisalign Case Shootout. Woohoo, yeah. All right, in keeping with this year's summit theme of Seize the Day, what you're about to see represents how some of your colleagues have acted on the opportunities that have been presented to them, and how those decisions to act have truly, truly changed patients' lives. Once again, we challenged your colleagues to share with us one of their most difficult cases. This year, we received an overwhelming number of entries, and our esteemed clinical panel of judges have narrowed it down to the 4 finalists that you're about to meet. So back, by popular demand, the 4th Summit Case Shootout. This is how it's going to work this year. Each doctor is going to come up. They're going to briefly present their case. Audience, as you listen to the case presentations, I need you to keep the 4 things in mind. Chief complaint, degree of difficulty, treatment strategy, and final outcome. At the end of the 4 presentations, we will ask you to vote on your favorite case. This year, we're going to ask you to vote for your favorite via text from your cell phone. After all of the doctors have presented their cases, you're going to have 1 minute to vote for your favorite case. So, without further ado, let's go ahead and get started. So please welcome our first presenter, Dr. Hinkle. Welcome.
Hi, Kathy.
Good to
How are
have
you? Thank you so much. I'm Mike Hinkle. I'm from Tulsa, Oklahoma, and I'm thrilled to be here. Love Invisalign, have been so excited about this opportunity, so thank you for sharing this with us, and let's get going. Tulsa, green country, northeastern part of the state, absolutely a beautiful place. You might be thinking of cowboys and Indians or oil wells, but this is Philbrick Museum, which is about 1 mile from where my office is located. If you ever get the chance to come to Tulsa, we invite you. I think you'd really like it. Next thing on the agenda, we moved into a new office this last year, and I took 4 years building this and got it finished just in time for the economy to collapse. And so you can imagine we're still digging our way out of that one, but it's a beautiful new office, and I will tell you that a new office means new patients, and new patients that are going to say yes to treatment. It's amazing to me. It's the magic pill, so consider that as you look at your planning. New equipment, technology, it looks and feels so different compared to what I did for 27 years. And you know, sometimes I just wake up and just think it's a dream. It feels so good. It's so much fun to go to work. We're going to talk about Erica today, and the sweet thing about this story is that she is the 3rd generation in this family that I've gotten to treat. That's what I love about cosmetic family dentistry, is general dentistry. Never know what I'm going to do tomorrow. That's what I love about it. But Erica's family, I started with her grandmother, who was about 4'10", and worked on her, and then I worked on her children as they got married and started families, and now Erica is here. And I treated her sister with straight wire, and I have 20 years of straight wire experience before I put that stuff in the garage, and that's when I really got serious about Invisalign. And so this is her before pictures. I was really concerned when she first came in for treatment because she had debilitative crowding, and I looked at the case and said, Mom, you know, this is not the same as her sister's case. It's much more extensive. And so we need to talk about what your options are. We can refer her to an oral surgeon, and she can have both her upper and lower jaw reset, and she can be wired for several weeks, or we can discuss extensive headgear wearing, which I had done before through the European ortho products and the schooling that I had gotten in the 80s. Or we can talk about Invisalign, which is the future, and I really believe in that, but I'm going to have 110% cooperation. And so she had some really deep emotional issues, and this is really how she presented, and it was it was a shock for me to think, wow, what am I going to do? How am I going to tackle this much crowding? And so with lots of years of straight wire experience, it gave me enough confidence to know that there is one little trick in your bag if you know it, and that is second molar extractions. And I felt like the oral surgery approach and the extensive headgear approach were both way too traumatic for someone who already was traumatized by her own smile. And so we said, let's try the Invisalign, and Mom said, okay, I trust you, I believe in you. And so we did just that. We took our impressions, we got started, but I always knew that we were looking at second molar extractions. A little summary here, and I'll try to be brief. She started at age 13. The ideal time is age 11 or 12. And this was, if nothing else, hopefully I can win Methuselah's award today for the most number of aligners. We did 81 upper and 82 aligners in 3 years of treatment. And so it was a tough case, and my motto is, if at first you don't succeed, try again. So we're going to look at some, let's see here, let's get it going here. There we're going. So Mom would bring her in every 6 weeks and say, all my friends say nothing is happening. And I would have to get out the ClinCheck again and say, well, let's look and let's talk about what's supposed to be happening at this phase, because all the movements in the back, and a lot of you guys are not really seeing much movement yet until the end of treatment is when it really started to show. And so that was the first phase of treatment. Now we'll look at it from the overjet position. Once again, most of the treatment is in the back. We're distalizing, and then at the very end, the anteriors drop into place. And when you look at the third direction, now you're starting to see what I was trying to get Mom to see, is that you've got to realize that all the action is in the back, and at the very end, things fell into place for us. When you take out second molars, they're so much easier than impacted wisdom teeth. I like to take out impacted wisdom teeth, but this actually saved her money. They simply couldn't afford the financial obligation of looking at putting her in a hospital and going through the oral surgery option. It was not possible for them. This was something that they could do. And so the next thing, this is the mid-course correction, or our second phase of therapy. And as you watch it over and over again here, you'll see that we're working on the midline correction this time, and we did get a lot of the anterior overjet corrected. Unfortunately, what you always see on ClinCheck is not exactly how it tracks in the mouth, but I still was pleased with the first phase of therapy, and I did have 110% help from her, so we were grateful for that. And then our third phase of treatment, we went into the refinement, and we closed things down a little bit more, did some rotations, and her final results, as we look at next, well, actually, this is the pano, and it shows her second molars in place. We saw that all the thirds were in place, and this is before treatment was started. And the very first thing we did was start with second molar extractions and the impressions for Invisalign. Following that, this is our after pictures, and she's a beautiful Hispanic young lady. She's now 16, driving. Her life has changed, and her smile has changed. And I know deep in my heart it's not perfect, but I also know deep down in my heart that she's had a miracle. Invisalign was a miracle for her, and she didn't have headgear, and she didn't have her jaw broken. She has 28 functioning teeth, and she had a happy and enjoyable teenage 3 years of treatment because she didn't have wires poking her. Her teeth were clean. She didn't get a single cavity, I don't believe, during the whole treatment. And so for her, it was a miracle. The wisdom teeth, as you can see, the thirds have dropped down into place, and the lowers are a little slower to erupt, but they're coming along nicely. And one of my little secrets is I really like super white teeth and bleaching, and so we use a TPH bleaching white on almost every single posterior filling, and they really sparkle, and the patients really get into that as well. As I mentioned earlier, my early training in the 80s was through EOP, and if anyone here thinks that after maybe treating 2 or 3 cases of Invisalign, they're ready to tackle this, I would recommend that you look for some more extensive training besides my speech today for some real good help on second molar extractions, and you can reach them through EOP. We have, here we go, thank you, a thank you note from Erica, and then what you'll see is she has become fearless about her smile, and she is using it all the time. Her goal is to do modeling. She is looking at her options in modeling. She's excited about the concept of someday running my dental office. When she first came in, I couldn't get her to even answer me a question. How was your day at school today? She just ignored me. She was all clammed up, and now she comes in the office and she simply will not shut up. She is nonstop, a totally cosmetic miracle. And so we just realized that dentistry is different for everyone. But I would ask the doctors and the assistants in this room and the hygienists, does Erica look to you like an ideal Invisalign case? And I would challenge to say that most of you would say no. And they would say what I've heard 1,000 times in Tulsa, Oklahoma. Well, I went to the orthodontist, or I went to this other dentist, and I was told that I was not an ideal Invisalign case. And I challenge you, if I can do this with Erica, and I've done 76 cases total, you can do great things too. But you've got to open your mind, and you've got to open your heart, and realize that if you believe, everything is possible. Thank you so much. Okay, that's right.
Thank you so much.
Thank
Wonderful
you.
job.
Thank you so
and
much.
good luck.
You bet.
For Dr. Lunt. Okay. All right. Now, the moment we have all been waiting for. The winner of the 2009 Case Shootout is Dr. Mike Hinkle. Congratulations. Congratulations, Dr. Hinkle. There you go. Even if you are a Sooner. Sorry, couldn't resist. Go, Pokes. Okay, congratulations. Please join me one more time for all of our doctors. Dr. Hinkle, Dr. Moore, Dr. Zimmerman, and Dr. Lunt.
Thank you.
Fabulous job. Thank you all so much.
Bless you. Thank you so much. Thank you. Love being up here with you guys.
Wonderful.
Thank you so
very
much.
much.
Thank you.
Thank you.
Now, I have to say just one thing, because if you ever get one of these, you know, in the Oscars, you get to say one word of thank you.
Absolutely.
Dr. Perry Jones helped me set my case up in Tulsa, Oklahoma, and he said that if Invisalign can do what you think it can do, someday you'll be lecturing. So, Dr. Jones, this goes out to you. Thank you so much.
Again, thank you to all of our doctors. Thank you very, very much. Fabulous, fabulous cases. Truly, truly life-changing.